So this, it seems, is the Bone and Soft Tissue Sarcoma Awareness Month. And right at the outset, I'd like to thank the JASCAP Foundation for the phenomenal work that they do. And Dr. K.V. Ganpati has been its face for us for the longest time that we've been around in Tata Memorial. Now, I'm being told that I'm the third musketeer in this teamwork. Our radiation and medical oncology colleagues have already introduced in brief about what it means to diagnose and treat a sarcoma. Now, I'm Dr. Prakash Nayak. I represent the Department of Surgical Oncology at Tata Memorial Hospital, and over the course of the next few minutes, I'll give you a brief overview of what it means to have a sarcoma, how common or rare is it, what are its common symptoms, and how do we treat it, and how have outcomes improved over the last 2 to 3 or even 4 or 5 decades. Now, the first question that we ask is, what is a sarcoma? Now, a sarcoma can arise either in the bone or in the soft tissue. It's a malignant or a cancerous tumor. The commonest age it occurs is in the growing age or the teens, usually after the age of 10. So we see a lot of our patients are young, in their teens, early 20s or 30s. And then there's a second peak which occurs much later in life after the age of 50 or 60. Now, no age is immune, but these are the commonest age groups in which we see them. Now, how would you know that you have a sarcoma? To introduce this concept, I'm going to tell you a brief story. And this story is about a very famous individual that all of us may have heard of. His name is Terry Fox. You should look him up online. Terry Fox was a Canadian athlete, and he became a legend way back in the 1980s. In fact, exactly, I think it was 1981. And why have I chosen Terry Fox to start this story? Because I think his story encapsulates everything that we need to know about sarcoma, its treatment, and how it has evolved over the past 3 decades. Now, Terry Fox was an athlete. He was an avid basketball player and a runner. Just about in 1977, way back, and he's a Canadian, he was driving a car and he had a small accident, after which his knee was paining, and that pain didn't go away for a few months. He then got it checked when they realized that there was also a swelling along with pain. Further radiographs showed that he had a bone-forming tumor around his knee. Now, why have I specified knee? Because around the knee is the commonest area where we see these tumors, because around the knee is also the growing part of our long bones. Then he had a biopsy which showed that he had something called an osteosarcoma, which is a high-grade cancer that arises out of bone. Now remember, this was back in the 1977, where treatment for these tumors was in its infancy. Not many options were available. Now he, back in 1977, after he got a diagnosis of this tumor, unfortunately needed an amputation. He had an amputation that was performed above his knee. Now soon afterwards though, while he was in the hospital, within a few months, he had got an artificial limb put on. And this individual was extremely optimistic. And right around when he was recovering in the hospital, he realized that the first ever amputee had completed running a marathon. This was in New York. And he told himself that this is something he's going to take up to build awareness of osteosarcoma, because his treating physicians told him that this is a rare tumor. Now look at his fortune. This year was 1977 or 1978. This was a time when chemotherapy had just begun for osteosarcoma. And his doctors told him that, Terry, if you had this tumor around 2 years ago, in the early 1970s, your chance of survival was only 15%, 15 out of 100, which means it was a dangerous tumor which would metastasize or spread, and a majority of the patients may end up losing their lives. This was way back in the early 1970s. But in 1977, when he had his tumor, his doctors told him that we can give you chemotherapy after your amputation and your survival chances are close to 50% or maybe better. Now this sparked an interest in Terry Fox, and he said, well, science and research is extremely important, because had I been born 2 years ago, my survival chances would have been 15%. And now in 1977, when I have this tumor, with chemotherapy, my survival chances are 50%. Today in 2022, when you catch this tumor early enough and you get the correct chemotherapy cycles, the correct surgery, and followed by chemotherapy where the treatment goes on for almost 8 months, your survival today can be as good as 70 to 80% in the first 5 to 10 years of life, which means the vast majority of patients who today get an osteosarcoma or an Ewing sarcoma, which is the other very common bone sarcoma that occurs in the young, it's a very curable cancer. Up to 70, 75 to even 80% of patients who are caught with an early tumor can go on to being cured for life. And that's an important message. The other important message is most bone sarcomas, except for chondrosarcoma, which is a rare tumor, a cartilaginous tumor, the commonest ones are osteosarcoma, Ewing sarcoma. They get chemotherapy, then surgery. Some patients in Ewing sarcoma also get radiation, and then you again get chemotherapy. And this whole treatment goes on for around 8 months. You generally get surgery around 2 to 3 months after your diagnosis. Now remember, Terry Fox had an amputation way back in 1977. Today, when the tumor is caught in time, over 90% patients, we can save their limbs. So not only is the risk or the chances of cure very high, the vast majority of patients also get what we call limb salvage, which means we are able to remove the tumor, reconstruct the limb with endoprosthesis, with or without plastic surgery, and you can get very good function. So two big messages is: one, very high chance of cure, and two, we can still continue to have our limbs which are functioning. Now what happened to Terry Fox? I began a story, I have not completed it. Now he, as I said, had an amputation, but while he was in the hospital, he said, I'm going to be running a marathon even with my amputation prosthesis. In 1980 or 81, he started in a small island called St. John's, Newfoundland, which is in Atlantic Canada. And he said, I'm going to run a marathon every day to raise awareness. And he said, I'll raise a few dollars. And today, the Terry Fox Foundation till 2020 has raised close to $800 or $900 million across the world. He's an extremely famous person who started with a very small hope, which was to raise awareness for osteosarcoma. He ran, I think, close to, for a year or 250 days or more. He traveled more than 1,500 kilometers. He had run across Canada, and by that time he had become not only a Canadian superstar but a global superstar. He was amongst the youngest people to have been commemorated in the Order of Canada. And why am I saying this? Because towards the end of his run, this was I think in 1981, about 4 years after he was diagnosed, unfortunately the tumor had spread to his lungs. And he had to stop his run, and around I think mid 1981, somewhere around June, we lost Terry Fox. Now what I'm trying to tell you here is, being a cancer, yes, this cancer has a risk of spreading. Where does it spread? It usually spreads either to the bones or to the lungs. And how do we treat it? We treat it again with chemotherapy, and as long as you can remove every area that has spread, we have a chance of cure. Now how do patients present? Now how would I or you know that I have a tumor or a sarcoma? Now generally, as we said, we'll have a swelling around the knee. The swelling around the knee, if it's a bone tumor, will generally cause weakness of the bone that may risk a fracture. We generally call it a pathologic fracture. What does that mean? You have some pain in your knee which does not go away. There's a swelling that comes along with it. The pain worsens at night, doesn't allow you to sleep. And occasionally, with very minimal activities like climbing down stairs or running, one may break our bones because the bones have been eroded, eaten away, and weakened by tumor. These are the symptoms of a sarcoma. Bottom line, anytime you have a swelling, which is either in the bone or in the soft tissue that you think is growing, the most important thing is you must visit a tumor surgeon or an orthopedic oncologist, and you must get it biopsied. And the biopsy must be with a needle. Almost all tumors can successfully be biopsied with a needle. You do not need surgery or open incisions to biopsy your tumors. So it's a very important message that you must give to your colleagues, to your friends, to your relatives, that if you find a tumor or a swelling in the body which is occurring in the bone or in the soft tissues, it is very important that if your clinician is recommending ये गांठ है, बीमारी है, इसको निकाल देते हैं बायोप्सी के पहले और फिर पैथोलॉजी में भेजेंगे, would be wrong advice. The first step would be to use or do a needle biopsy, send it to a pathologist, know what kind of tumor we are dealing with. And why is that important to know? Because once you know what tumor you are dealing with, you will know what are the correct tests to do to check if the tumor has spread or not. In the vast majority of patients, around 75% of them, when they present with these tumors, they have not spread. They are localized to the bone or the soft tissue, which means our chances of cure are very high. And doing an unnecessary surgery there will increase the risk of the tumor coming back locally or even the risk of tumor spreading. So it's very important that you do a needle biopsy with the correct investigations to check if the disease has spread or not, and then follow it up with the correct order of treatment. For many osteosarcomas and Ewing sarcomas, we first give chemotherapy for up to 12 weeks, then do surgery. And as I said, some Ewing sarcoma patients may need radiation, and follow it up again with chemotherapy. Now, this may be a very difficult process because the chemotherapy doses are very intense, but it is important that we finish the entire course of this treatment for the best chances of cure. Now, one may ask, can one guarantee that I have a local tumor, I've been treated and the disease is never going to come back? No. Even when we do everything right, 30 to 40% patients, or sometimes 20 to 30% patients, based on the kind of disease, the size, the location, may have disease coming back. Which means we keep all our patients on follow-up. We see all of them every 4 to 6 months. We generally do a chest X-ray and a local X-ray. And if either of those investigations shows any problem, only then do we investigate it further. I'll end by saying, I remember talking about something called limb salvage. What do I mean by that? Terry Fox had an amputation where we had to cut limbs. In early 1970s, that was the only option available. But now we have many ways in which we can remove the whole tumor, and it's a big tumor and it's a big defect in the bone, which means if the tumor is around the knee, either the distal femur or the tibia, which are the long bones around the knee, get involved. We remove a big segment of the tumor and we replace it with a big metallic prosthesis. These are called endoprosthesis or are called megaprosthesis. And once we implant that and we cover that with the remaining muscles, many of our patients get very good function. They're able to walk. And oftentimes you wouldn't be able to tell which limb has undergone surgery. Of course, like any big surgery, it does have its complications. One is, of course, the risk of infection, which may be less than 10%. 90% of our patients do not get any infection. And as you would know, like any artificial prosthesis, no prosthesis is permanent. All prostheses have moving parts, plastic, which may have wear and tear with activity, and most of them need this endoprosthesis to be revised either at 10 years, 15 years, or occasionally earlier. So what are the big messages I want to give you? The big message is that if you have a swelling, pain in the bone, or a tumor in the soft tissue, first get a needle biopsy and get it checked by someone who deals with tumors or a specialist. 2, remember, most of them, when we diagnose them, are not spread. They are localized. 3rd, remember that these are curable, very highly curable. 4th, it's a very rare tumor, less than 1% of all cancers. So we know, all of us don't have to worry that sarcoma is lurking around in most of us. No, it's a very rare tumor. And last but not the least, today amputation is rare when it is diagnosed early. limb salvage is possible, limb salvage is successful, and you must get it treated with centers that are used to doing it in high volumes so that you get the best outcome that's available. Best of luck to all of you. Thank you.